And so I welcome all the other speakers to join me, and then we can try to frame all the questions we have with Katrin, Paula, Susan is here, and Julian. Okay, so thank you so much. And then I think it was really a beautiful, I think when we summarize all those talks is that we're really starting to rethink our approach to chronic enteropathy, correct? Tomorrow we're going to talk a little more about acute diarrhea, so we can focus today on the chronic enteropathy. And so I think one question that was the most prominent question is, how can we give tips to practitioners who are starting to rethink this concept? What is the biggest, what are the, small tips and tricks that they can start implementing this in practice, right? To give them confidence that maybe we can convince owners to do multiple diet trials. So I don't know, maybe Julian or Kati or Susan.
Sure, happy to start. I think we've got, from a point of view of diet, we've got so much data now that says, look, most of these dogs respond. And now we've got nice studies like Susan has done where we show that these dogs respond for a long time and they don't come back. And so I think having this as an argument for the owners is really useful because we've got some data. I would say one other thing is give the owners the expectation. If I start a diet, I'm expecting a response within 2 weeks. If I don't see a response within 2 weeks, we just move on because it's not going to work. And so having this really rapid response is one of the best way for owners to keep with us and to try to do it. So I think that would be my two main things I'm using.
Mm-hmm.
Plus I make them pay a lot to come and see us. So then they listen to us. But I think that's the other thing. We have more time to explain that to the owners. So having a summary of these for the owners can be really useful in private practice.
Mm-hmm. Katrin?
I think another thing we also do is kind of scare our owners. And we don't scare them, but we try to educate them about the downsides of antibiotic use. And I think a lot of owners are still not aware of that. I mean, I think it's changing a lot. And a lot of owners say, oh no, I don't want to use antibiotics. And but still, I think trying to educate them. So let's do this. And I know it's hard. And I know elimination diet is one of the most challenging things you can do. But still, what's the alternative? And there is no easy alternative. There are always downsides to other treatment options. So I think, and actually we don't have that much problems to convince owner to try another diet, even after the third or fourth diet trial, and so they're still willing to use something else. And yeah.
So Susan, in your study, how many diet trials were usually recommended or performed? I know that Zurich and Peter Koch is very into multiple diet trials. So
actually, we should try at least one, but actually they told us to try several diet trials before going to other therapy trials.
Mm-hmm. And do you start with a special diet in those studies, or was there kind of a consensus which diet was the first line treatment in your study?
I think the study situation is not that clear, but often we use hydrolyzed diet because of the unclear history of diet of the animal.
I mean, Kati, you mentioned a little bit about your dietary approach. Can you maybe summarize it one more time for us, how you would approach which diet first? And
I think so. The thing is, it's very individual, and it changed a little bit over the last few years. I have to say, maybe 5 or 10 years ago, we used hydrolyzed diet in almost every patient because we thought, well, it's probably the most effective one, and so on. But still, now, yeah, we try to individualize it a little bit more. So especially, I told you earlier, if there is a suspicion of food allergy, like with pruritus or something else, or for example, if there is a re-challenge or something, we use the hydrolyzed diet. But sometimes we also try to use monoprotein diets before that, and homemade diets as well. So it's very individual, to be honest, but I stand by that what I said earlier. I still believe that you should try at least once a hydrolyzed diet, because they're still very effective, and however they work, but they work.
And Julian, what is your approach at your hospital?
I think we very similar approach in the sense that it's depending on what they had, what they want to eat, and I guess PLE, so protein losing enteropathy, would. I don't want to go into that because that's another layer of complexity, but that would change what I would recommend. I was thinking about your question and in practice, and I think one of the studies that was shown was done in Edinburgh looking at diet, which was not a hydrolyzed diet. But what we have is we have an amazing nurse called Susan Campbell that is going to, we can refer her the cases, and she's going to support the clients while they're trying to go through the diet trials. And I think that is actually remarkably incredible what she does in making people understand what the diet trial is, but also to give these little tips to the owners to continue them on this trip of trying a diet. And so this, I think, this having this catch up with the owners at regular events or where they can ask if there is a problem is really helpful.
Mm-hmm. I mean, Katrin, you mentioned partial response, right? So for you, what is a partial response, and where you say, hey, I don't give up, but that's a sign for me that I would continue. So what are the classical improvements that you would expect to continue with the same diet versus you give up and go to the next diet?
Yeah, so we usually say that there should be an improvement within 1 to 2 weeks. I think that's probably what everybody says. So, and then there's probably the full potential after 3-4 weeks or something like that. And for us, it's always important if the owner is satisfied with the improvement. So I always think if there is still a little bit of soft feces going on, but the frequency is fine and the dog gains weight and looks fine, I'm not aiming for the perfect poop. For me, it's more like this discussion between how to get the dog better, but not maybe use other treatments. If I don't have to use corticosteroids, I'm very glad. So if the dog improves satisfactorily, I leave it like that. So the owner is fine with it. If not, we try to play a little bit with fibers and probiotics and FMT. And if there is no response at all, so we try another diet and then go from there. And after the third one or so, we finally kind of give up and use some immunosuppressants, of course.
Yeah. I'll come back to the next step, but one question came up is when a dog responds to a hydrolyzed diet, for example, how long, I mean, you mentioned this in your talk a little bit, but must it generally be maintained, the same diet? Or what is your experiences? How many dogs you could eventually transition? And if so, what is the minimum amount of time then you would wait to start the transition?
Oh yeah, that's a very good question, and I think nobody can answer that right now for sure. So the thing is, usually we keep the dog on the diet till the clinical signs resolve, or if the dog is fine enough, and then usually so the thing is, it seems like if the dog is fine for a while, maybe for a month, and you do a re-challenge there, it tends to tolerate more food than before. It's really weird, and I'm not sure if I can prove it right now, but it seems like they improve when they're fine for quite a while. So usually we recommend that they stay on the diet for a few months, and then maybe they can incorporate some protein sources or some diets they would like to feed. And the problem is that most of our donors, they come to us after a year or something of diarrhea, and they don't want to change diets at all if the dog is fine. So maybe it's a little bit different in a private practice where you see the dog for the first time and maybe only after a few weeks of diarrhea. So I think it's fine to change. I think diets after a few weeks, a month, to try new things. But what I also think that these idea of only 30% of dogs develop clinical signs after re-challenge, that's not the fact in our clinic. We see way more, as I mentioned, in the hydrolyzed diet study. So we have almost 90% of clinical signs when we try to use the original diet. So I'm not sure if that's the case actually, but usually we tell them to try to incorporate some new proteins, some other proteins, and slowly change to the preferred diet.
What is the at a workup of a patient comes to your clinic, and also Julian and Susan for all of you, is how much workup do you do and before you start diet trial, and then when diet trial fails after multiple trials, what is the next step in the workup? Maybe Julian wants to start.
Sure. So it really depends on the patient. In a well patient, that we will most of the time we'll have some blood work done by the ref-vet. We might do that, but we most likely won't do much more than that. We'll go with a diet trial. We won't even do an ultrasound of the abdomen if the physical exam is normal. I think for me they are like alarms. So if the animal is losing a lot of weight, if we've got a low albumin, if we've got really marked clinical signs, that would be when I would push to do more. But to be honest, we see at least, I would say, at least 50% of our cases where we do nearly nothing more than just the bloods, and we send them for a diet. If the owners come to us, they're usually motivated, and we will do an ultrasound to make sure there's not something else underlying. But it's rare that we have a dog where we're not going to just start with a diet trial.
And Susan, in Zurich, the same?
Yes, we exclude other possible causes for the gastrointestinal signs, and afterwards, normally, if the diet is not successful, or several diets are not successful, then most often an ultrasound, not ultrasound, biopsy examination is made.
So that brings me actually to the next point. So after multiple dietary trials, so somebody tried really many trials, are you moving? So you're moving afterwards to biopsies in every case, or how is it? I think there's also little changes here. And then if so, what are the biopsies? And because the question comes, if you have neutrophilic inflammation on biopsies after multiple trials, would that be an indication for immunosuppression? So maybe let me ask first Katrin and Julian what they do as a next step if dietary trials fail.
Kathy? FMT or
FMT? You can start. I talked already so much.
So maybe, I mean, often my next step might be to do an ultrasound, and then I would do an FMT at the same time. I would tend to do an FMT at that point.
Okay, so that's a new experiences. Katrin?
So I think that the crucial question is, do we always recommend endoscopy? And so I think that's actually a question that's really hard to answer, because I know every textbook says it's not IBD, it's not chronic enteropathy without histopathological proof. And so usually we recommend it still, but I have to say we have some owners that can't afford endoscopy, and except for some specific breeds, for example, or especially if there is vomiting involved or hematochezia, or protein-losing enteropathy, we always recommend endoscopy and really try to force it. But in these other cases, these 3-year-old other kind of healthy beside the gastrointestinal signs dog, it's sometimes really hard to convince the owners and to do that, full-heartedly, because we all know that probably in 99.9% of cases there is this lymphoplasmacytic inflammation going on, what we get back, and we don't change anything in our treatment. But still, I mean, it's still there, it's still out there, so we always recommend it. But we also started immunosuppressants if, for example, the owner couldn't afford endoscopy or something.
Okay. Paula, since you're a pathologist, what are your thoughts
Yes.
about?
We haven't talked much about protein-losing enteropathy. That's like a kind of a different condition. But for those cases of protein-losing enteropathy, histopathology is helpful to show some features that we see in those patients. So when we see like teal dilation, creep dilation, we know that these patients often benefit from a low-fat diet. So it's something that's really helpful to guide treatment, those morphologic features, different from the inflammatory infiltrate, as we discussed, that cannot predict treatment response. And actually, neutrophilic inflammation is quite common in cases of lymphangiectasia, and I believe that's probably secondary to leakage of lymph and rupture of the lacteals. And I also think that depends on the geographic region where the veterinarian works. So, for example, here in Texas, we see quite a lot of infectious diseases. Quite often we see like cases of prototica, that's an algae, pitiosis, that's a oomycete, fungal-like, and for those cases, the histopathology can also be helpful. And then also other like things that should call your attention on your histopathology report, if the pathologist saw macrophages and the eosinophilic infiltrate was like at least moderate, neutrophilic infiltrate moderate, these are some indications that you should do some additional testing before immunosuppressing. So, for example, special stains that can be used on the biopsies, so to look for these infectious organisms, especially if it's an area that's common, right? And there are some certain parts of the world, especially tropical regions. And yes, so these would be like the main indications before immunosuppressing. And also there are like other testing that can be done, like for histoplasmosis, antigen testing, serology for PTO, etc.
Thank you, Paula. That's very useful information. Let me go back a little bit to just briefly antibiotics. I think we probably all agree that today's discussion pretty showed that antibiotics have not really can be useful, but should definitely not be a part of the standard treatment, or at least last minute. The always question comes up is that there's this in literature, not literature, there's this thought that antibiotics have anti-inflammatory effects, and that's why some clinicians still add it to that. Is there any proof of that we know of, or is it just something that has been mentioned but not necessarily proven? Is anybody of you aware of it? I guess nobody.
Not aware of any proof.
Okay. So in the end, I think all the studies pretty much showed that without antibiotics, we also have long-term success and mostly even better success, correct?
I think that's really the big thing, right? Is we've got more and more studies. What we were missing a lot of studies that were following long term. We're starting to have these studies. And we've got also now studies where we don't use antibiotics and we get the same outcome or better outcome. So there is now enough to say, look, we've got options, except for these specific cases where we need to use them.
Susan, maybe one question to your study, because I know that you had 0 dogs that were antibiotic responsive, but you had a few cases that were non-responsive. So assume those non-responsive still had an antibiotic trial, but didn't respond, or?
All of the non-responsive dogs had an antibiotic trial in order to then call them non-responsive.
Okay, perfect.
So
okay.
actually, yeah.
Excellent. Okay, excellent. So we have only a few minutes left. Maybe just a few questions about FMT. So I think there seems to be slowly more data coming, evidence that it can be useful in some patients, obviously always after dietary trials, correct? Kathy, one question for you. Body condition score, should that be a selection criterion for the donor screening?
Yes, we do that. So we don't want obese dogs because we know that there might be some changes in the microbiota going on. And maybe some pro-inflammatory state. So we refuse that. And if the dog is actually very, very thin, there's also probably something going on. So we use these normal body condition scores between 4 and we tolerate 6. So, and this is something, as you know, Jan, that also will probably be part of our consensus statement. Yeah, so yes, I think there is actually a reason for that. I mean, so I mean, we can't there. Everything I say, I have to admit there is no study that actually tested that for FMT. So use obese dogs and do FMT and see if there is some more clinical signs or something like that. But it's more like extrapolated from experiences, from studies from human medicine and other stuff. So, and I think, as Julia said, there is so much going on. So probably we might change our mind in a few months or years. But still, for now, we want a normal body condition score and also the normal behavior, as I mentioned earlier, because we know that there are changes in the microbiome in people with neuropsychiatric diseases, aggression, depression, autism disorders, AHDS, and so on. So we don't want that as well.
Maybe Susan, for you, your mentor Peter had a comment that feels very strong about it, that biopsies yielding lymph-specific inflammation do not help guiding therapy. And we do often for the owners to exclude cancer, which is also probably quite rare, correct? One final question, okay, we're still learning much about FMT, is about oral FMT with capsules in chronic enteropathies. I know that's not available in Europe. I think there's some companies in the US who's selling that, so I'm not sure if you guys have experiences on the European side.
So it's not commercially available, but
exactly.
We use them. So, but we just started using them, so only a few small time ago. So I can't tell you anything. Maybe Julia, you can share something. Do you have them?
So not commercially. We're starting to look into that, and this is something we're going to do soon, but no data at this stage.
Yeah, maybe I can add something that we have in antibiotic-induced dysbiosis, oral capsules work great. I mean, they really a few a day, for a few days, and they can bring back the microbiome. In chronic enteropathy, we have a few cases that adding it on can be helpful. So I think, but at the moment, there's no proof if one is better than the other. I think the consensus probably will also have is, and that also a question came about dysbiosis index with high dysbiosis index, is that I think it seems to once we have those changes, right, we have those changes of chronicity, then usually we know it's going to be a long-term management in many cases. So it's difficult to dissolve, is this one treatment this or this? It's just a part of this multimodal therapy approach. And I think all the data showed that often those chronic GI cases are going to have multiple FMTs until we put them in remission, and then we go by the time. But the experiences would likely to show that some of those markers like increased dysbiosis index, low cobalamin, if they are present, and in many cases, not all of them, but in many cases, that's going to be a chronicity. Those changes are going to be there for a long time. So I think, and that's why it's probably difficult to dissect, is this therapy better than the other one? It's going to be all part of one therapy in the future. Perfect. I think we are at the end of our time. I have just one comment from Ugo Lotti, but I think it's just my comment that he has seen some cases of neutrophilic infiltrate in young German Shepherd dogs that are severely dysbiotic. So that's just a comment, especially an index over 5. But again, it shows too that once we start looking at chronic GI disease, there's many things happening at the same time, correct? And I think that's probably also a takeaway from today's. It's not treating one side of the GI tract, it's modulating many different parts for long-term success, correct? Perfect. So with this, Natalia is back, and I think she has a few words. I would really like to thank all of you for really great talks. I think we definitely seeing that there's a lot of happening in GI disease, maybe not the most visual, but a lot of things changed the last few years, I believe, correct, in our approach to diagnosis and therapy. So that's really exciting. So thank you so much, all of you. Thank you, Susan, Katrin, Paula, and Julian. And Natalia has a few words for us.
Okay, thank you very much, Jan. Thank you very much, everyone, for this great first day of the Microbiome Forum. We learned a lot. You shared a recent scientific research and data. You share your practical experience. And what I hear also, you're all asking a question, how we can convince our clients to do what we believe is right for their pets. And, you know, we also, as the Institute, we also are concerned about that, how we can help to veterinarian to have a good and proactive conversations. Just yesterday, we had a webinar with Vasava on really how to take a conversation with the stressful client who is, you know, emotionally charged. So if you want to go back and check it with Vasava, there were a couple of webinars we were running really on the communication skills. So saying this, I would like now to share a couple of slides. We have a lot of research available on the microbiome. And as I said, we do the third year in a row, the Microbiome Forum event. So all these previous presentations from Jan Suchodolski and the group of experts is available on the Purina Institute.com. You can go and scan QR code there and listen the other lectures from the previous years and all other important scientific information you can receive over there. And in the resource center on the platform, you also can get certain type of the information could be useful for you, and go and check it out, which is on the red bar. And again, don't miss this book. This is really a result of the effort of 40 plus international global experts in feline and canine clinical nutrition and practical veterinary skills. Because here, for anyone who, you don't need to be a nutritionist to use nutrition as a part of a management of a disease. You can use this book as a daily tool to get you up to the speed with the latest information about nutrition and use it in your clinical practice. Please scan this QR code. You will receive free ebook that is not available in other way on the other sources. And the last but not the least, we are living in the era of social media. You can follow the Purina Institute and advices from the experts on social media. You can see different hot topics on a very specific nutritional points, takeaways you can have home and really share with your clients. And we help you with the conversational tips, how to start the conversation, because it seems you may know everything, but not necessarily easy can communicate that to pet owner. And with this, I really appreciate, thank you for everything you shared with us today, Jan and the group of experts. Thank you very much. And looking forward for the tomorrow, day 2 of the Microbiome Forum. Thank you.
Okay, perfect. See you. Bye.
Bye.